Hello, everyone, and welcome to Springer Nature's Q3 2021 Medical Highlights presentation. Today, we will preview the latest books from our clinical medicine list, featuring titles from anesthesiology, dentistry, and much, much more. All right, so let's kick it off with our first titles in COVID-19 clinical highlights. Alternative medicine interventions for COVID-19. This research volume examines the available alternative, complementary, pharmaceutical, and vaccine methods for treating, mitigating, or preventing COVID-19. Coverage includes traditional Chinese medicine, herbal remedies, nutraceutical/dietary options, and drug and vaccine therapies. All the methods discussed are critically examined to provide readers with a full, unbiased overview that includes pros and cons of each method. While the nature of the COVID-19 is still being studied and new research and theories are being published daily, this book provides readers with a comprehensive summary of current research on alternative and mainstream treatment and prevention methods. The next title we have is Identification of Biomarkers, New Treatments, and Vaccines for COVID-19. This is a timely volume that covers new treatment approaches worldwide and looks at COVID-19 vaccine development efforts too. Leading experts will discuss new treatment approaches, vaccine development, mental health aspects of the pandemic, and convey the results of survey studies. This book will be an excellent resource for researchers studying virology, metabolic diseases, respiratory disorders, and for clinical scientists, physicians, drug companies, and healthcare services and workers. The next title we have is Teaching in the Post-COVID-19 Era. This handbook showcases extraordinary educational responses during the pandemic and discusses valuable innovations for teaching and learning in times of COVID-19 and beyond. It examines effective teaching models and methods, technology innovations and enhancements, strategies for engagement of learners, unique approaches to teacher education and leadership, and important mental health and counseling models and supports. The authors share unique global perspectives from a network of educators and researchers from more than 30 locations, schools, and post-secondary institutions worldwide. Some case studies include Florida State University's Innovation Hub and Interdisciplinary Project-Based Approach, Yorkville University's Remote Synchronous Delivery and Blended Learning Approaches, University of California's Strategies for Making Resources Affordable to Students. Educators, administrators, policymakers, and instructional designers will draw insights and guidelines from this text to sustain education during and beyond the COVID-19 era. Next title we have is COVID-19 in Clinical Practice, Lessons Learned and Future Perspectives. This book assesses the main features of COVID-19 from a clinical point of view based on observations made during the disease epidemic in northern Italy. This area is one of the most effective areas in the world. So from sharing lessons learned from this experience and offering practical tips on implementing future programs for pandemic preparedness, this book is a valuable tool for medical practitioners and health policy makers wanting to better understand the complexity of the current and future global health crises. And the last two titles we have for COVID-19 highlights is Mapping COVID-19 in Space and Time. This book describes human dynamics in cities during and after pandemics. It examines the role of smart city technologies during COVID-19 and covers conceptual data and method issues of pandemics. With the accelerated pace of technological advances and growing divide on political and policy options, a better understanding of disruptive global events such as COVID-19 with spatial and temporal perspectives is an imperative and will make the ultimate difference in public health and economic decision-making. Through an in-depth analysis of concepts, data, methods, policies, this book stimulates future studies on global pandemics and their impacts on society at different levels. And the last title we have is Utilizing Effective Risk Communication in COVID-19, highlighting the BRCT. The BRCT is called a Benefit Risk Characterization Theater, and it can be used to significantly improve accurate communication of health risks from exposure to COVID-19 and assess how to best contain and control COVID-19. A BRCT is a familiar theatrical chart representation of 1,000 people with the risk and benefits shown by blackened seats. Since health outcomes can easily be put into such a chart, we show how BRCTs can be used objectively by professionals, the media, and lay people. It allows characterization and communication of health benefits and risks of COVID treatment and containment in an undemanding and straightforward way. And now in the anesthesia highlights.
Thanks, Jenny. Now in its second edition, Physics for Anesthesiologists and Intensivists explains and provides detailed up-to-date information on physics applied to clinical practice in anesthesiology and critical care medicine, with the aid of simple examples from daily life. The book includes lots of illustrations that bring the content to life. This title is written by a clinician for clinicians and uncovers the science linking physical laws to patient care. The author is based in Italy, has published extensively both in books and journals, and is immersed in the topic as he himself is an anesthesiologist and an intensivist. Next, please. Quick Hits and Obstructive Anesthesia provides easy to follow guidance on how to manage emergency situations and common problems in obstetric anesthesia. Obstetrics is concentrated on pregnancy, childbirth, and the postpartum period. This is a guide to common problems and provides core knowledge to facilitate anesthesia care. It should be used as a cognitive aid for emergency cases and as a decision-making tool for urgent management plans.
And for highlights in cardiology and critical care medicine.
All right, first here is multimodality imaging innovations in adult congenital heart disease. It focuses, as the title suggests, on congenital heart disease, or CHD, and emerging imaging technologies. It covers all clinically relevant aspects of new cardiac imaging technologies, including a comprehensive explanation of their basic principles and clinical applications. Because innovations and emerging technologies for diagnosis continue to evolve, improving diagnosis and survival rates, this information will be in demand. The book is written by experts in the field who are also involved in patient care and discusses the practical application of multimodality imaging in daily clinical routine firsthand. Their tips and tricks and a wealth of clear and instructive illustrations make this a useful resource for beginners. Next, please. Reducing Mortality in Critically Ill Patients is a second edition title that describes the recent techniques, strategies, and drugs that have been demonstrated by multi-center randomized trials to influence survival in critically ill patients. These are patients who have acute failure of at least one organ due to either a pathological condition or a medical intervention and require intensive care treatment. Each chapter focuses on a specific procedure, device, or drug. The selection of topics was informed by the input of hundreds of doctors and specialists. The text covers a diverse and extensive array of treatments, just to name a handful: non-invasive mechanical ventilation, mild hypothermia after cardiac arrest, daily interruption of sedatives, growth hormone, a glutamamine supplementation, and tight glucose control. How-to sections and key point boxes provide accessible and practical information throughout, making this a helpful resource for intensivists, emergency doctors, and anesthesiologists alike. Next, please. Opioid Use in Critical Care is written by an expert author team from the University of Pennsylvania for ICU providers. It features algorithms and step-by-step approaches on how to navigate the balance between relief of suffering and the adverse effects of opioids. The book conveys practical, real-world recommendations on both opioid utilization and alternative therapies. Over 200 illustrations, photographs, and tables help deliver the information in a clear and easy-to-navigate format. Thanks.
Okay, and now for highlights in dentistry. The first title we have is Pediatric Dentistry for the General Dental Practitioner. This is a practical and comprehensive guide to the management of children and adolescents in a general dental practice. The commonly encountered oral and dental problems and their diagnoses and treatments are covered in detail in this book. There is particular attention to dental caries, dental trauma, anomalies, periodontal problems, and soft tissue conditions. This is an up-to-date guidance and history taking, dental examination, preventative strategies, and advanced behavior management. In addition, the relevance of common medical conditions to dental management is discussed. There are 4 sections in this book. each of which focus on a specific age group and will help the reader to relate clinical issues to the different dental developmental stages. Our next title is Innovations and New Developments in Craniomaxillofacial Reconstruction. This book is edited by a key opinion leader, Dr. Julio Acero. The book presents new technologies that are having a major influence on craniomaxillofacial surgery. Readers will find detailed information on the technologies themselves, their indications, and their benefits. The coverage encompasses the use of biomaterials and tissue engineering, virtual treatment planning, various applications of computer-assisted surgery, and intraoperative navigation. Robotic surgery, endoscopic approaches, and piezoelectric surgery are addressed within individual chapters in the book too. New developments in pediatric surgery are discussed, and the book concludes by examining the future of facial transplantation. The book will be of value for all of those who are interested in learning about the innovations and developments that are reducing morbidity and improving outcomes in patients who require craniomaxillofacial reconstruction. The next title we have is 3D Printing in Oral and Maxillofacial Surgery. This book is a comprehensive guide to new innovations in 3D printing and 3D bioprinting methods and their applications in oral surgery. This is an up-to-date information book. This is an up-to-date information on guided tissue, bone regeneration using 3D printing and 3D printing methods. The roles of soft and hard tissue printing in oral and maxillofacial tissue engineering are reviewed, and the use of 3D printing in multi and interfacial tissue engineerings are examined in depth. This book will be of interest to both oral and maxillofacial surgeons and biomedical engineers. The next title we have is Atlas of Oral Maxillofacial Anatomy. This is the first book of its kind to be devoted to the clinical anatomy of the region for dentists and for oral and maxillofacial surgeons. It has the important benefit of enabling readers to observe the anatomy from the same view as seen during invasive clinical procedures. This is critical for a better understanding of these procedures, and surgical annotations are included as necessary. It will satisfy the demand for such a comprehensive atlas in this field of surgery and will be welcome and timely for clinicians and trainees. Beyond specialists and residents in oral and maxillofacial surgery and general dentists, the book will be of value for craniofacial surgeons, anatomists, plastic surgeons, ENT surgeons, head and neck surgeons, and much more. And for titles in family medicine and geriatrics,
Thanks, Jenny. The second edition of Geriatrics for Specialists aims to be a single point of reference for advances in the care of geriatric populations across medical and surgical specialties. The aging population is a unique demographic with its own health challenges. Geriatricians are specifically trained to address these challenges, and there is a growing need for medical students to pursue this path. In reality, the practices of many medical and surgical specialists are dominated by older patients. This title covers the most common medical conditions seen in aging patients and provides approaches to treat these conditions across specialties. All original chapters from the first edition have been extensively revised and updated to reflect the rapid growth of new knowledge in the field. And also the new edition expands the number of specialist chapters to include dermatology, plastic surgery, and behavioral neurology. Next, please. While many texts explore the role of primary care professionals in geriatric medicine, the role of family doctors has largely been left out. The role of family physicians in older people care fills this gap and is intended for family medicine trainees and professionals, but it is also a useful tool to help geriatricians to more fruitfully interact with family doctors. This book provides a wealth of evidence-based indications and tips regarding geriatric medicine. The text introduces key elements such as frailty and the Comprehensive Geriatric Assessment, or CGA, and describes a range of characteristics unique to older patients, including a dedicated section on palliative care. The book emphasizes both the importance of a humanistic and research-based approach. Family physicians care for individuals in the context of their family, community, and culture. As we experience a global demographic shift, family doctors will be increasingly involved in caring for older patients. Next, please.
And for key titles in general surgery and health informatics.
Okay, written by expert surgeons with unique perspectives from a variety of prestigious U.S. medical institutions. The fourth edition of the ASCRS textbook of colon and rectal surgery serves as a valuable resource for surgeons and healthcare providers at all stages of their career caring for patients with colorectal disease. This is both a how-to manual as well as a logarithm-based guide, and the text links to videos that give the reader an upfront look into technical aspects of colorectal surgery. This edition provides all newly written chapters organized around the pillars of colorectal disease: perioperative, anorectal disease, benign disease, malignancy, pelvic floor disorders, and a miscellaneous section that covers aspects of both inside and beyond the aspects both inside and beyond the operating room. Thanks. Next, please. Okay, packed with practical information on managing the most frequent surgical emergencies, Trauma Centers and Acute Care Surgery offers an overview of acute care surgery, focusing on the four main branches of this novel subdiscipline. These are trauma, general emergencies, critical care, and rescue surgery. This is a general view of acute care surgery, which addresses the most important issues in depth. Common care cases include colonic perforations, obstructions, acute pancreatitis, biliary tree stones, and caustic injuries. The text covers how trauma centers and trauma teams are organized alongside the most advanced critical care techniques for major traumas. Presenting cutting-edge strategies, this book will be of interest to all professionals involved in emergency surgery and intensive care. Next, please. Study surgery serves as a complete single reference for the surgery board clinical exam and is clearly written with surgical trainees and graduate students in mind. After the exam is over, as a bonus, it is also a beneficial early career reference. The book provides A to Z information of surgical disorders in a concise and engaging format. It is unique from other books because each chapter includes a practice section made up of multi-case scenarios and performance checklists to help cement comprehension and commit the information to memory.
Okay, and our last title in informatics is the Biomedical Informatics, the 5th edition, after the very successful 4th edition. Biomedical informatics reflects the remarkable changes in both computing and healthcare that continue to occur and the exploding interest in the role that IT must play in care coordination in clinical practice and treatment. The 5th edition of this essential textbook continues to meet the growing demand of practitioners, researchers, educators, and students for a comprehensive introduction to key topics in biomedical informatics and the underlying scientific issues that sit at the intersection of biomedical science, patient care, public health, and information technology. Emphasizing the conceptual basis of the field rather than technical details, it provides the tools for study required for readers to comprehend, assess, and utilize biomedical informatics and health IT. New and heavily revised chapters have been introduced on human-computer interaction, mHealth, personal health informatics, and precision medicine. And now for highlights in imaging and radiology. What radiology residents need to know. This is the latest in a new series for radiology residents, written by a key opinion leader, Dr. Ronald L. Eisenberg from Harvard Medical School. A bit about the series. Radiology residents are often asked to learn a significant amount of information at a fast and unrelenting pace. The current available literature for residents is dense and includes more information than they can easily ingest, while the number, variety, and quality of images is often limited. What radiology residents need to know answers these needs for each radiology rotation residents will take. The material is presented in bullet fashion and divided into convenient subunits such as clinical information, imaging findings, and management. In most cases, an individual pathological condition can be presented in 1 page or less. This will allow residents to quickly review the essential information needed before their shifts and rounds. With liberal use of illustrations, 807 in this book, and an online bank of many more high-quality images, this book gives readers a comprehensive library of musculoskeletal imaging scans and serves as an ideal guide for radiology residents. Atlas of Clinical PET-CTs in Treatment Response Evaluation in Oncology is a superb guide to the use of PET-CTs for the evaluation of treatment response in oncology patients based on its ability to assess tumor metabolic statuses. Prompt and accurate evaluation of treatment responses is vital as we enter the era of individualized medicine, and this atlas will persuade readers of the considerable advantages of PET-CTs over conventional radiological and clinical methods, featuring a wealth of information and images and evidence-based teaching points. Disease-specific chapters clearly demonstrate the key role that PET-CTs can play in distinguishing early responders from patients who are non-responders or are resistant to treatment. Guidance is also provided on the reporting of PET-CT scans in post-therapy scenarios as well. The next title we have is RAD Tool, Nuclear Medicine MCQ, so that's multiple choice questions. This is a comprehensive tool that will help nuclear medicine and radiology residents and attending physicians to understand the concepts in nuclear medicine. The multiple choice question format closely resembles that used in board exams in nuclear medicine. Each question will have 4 possible answers, but only one of which is correct. Questions cover clinical applications of nuclear medicine techniques to cardiovascular, pulmonary, endocrine, skeletal, gastrointestinal, genitory, and central nervous systems. About 60% of the questions are linked to clinical cases, with each case having 4 questions on average, along with 1 or 2 images. The remainder of the questions are freestanding with or without an image. Answers are concise but supported by reference to the literature when necessary. Pearls and boxes are used to highlight the most important pieces of information. And while the questions are scrambled as in board exams, an index will categorize each question into one of the systems or topics. Breast Cancer Essentials, Perspectives for Surgeons. After standard surgical options, oncoplastic breast surgery is rapidly becoming one of the most important surgical topics that should be learned by attending surgeons. Breast cancer is a disease requiring multidisciplinary management, including surgery, medical and radiation oncology, radiology, pathology, nuclear medicine, genetic counseling, and psychological support. Each member of the treatment team needs to be updated continuously on breast cancer treatment because of its rapidly changing nature. The idea of writing this book stemmed from a collaboration between the European Academy of Cynology, the European Institute of Oncology, the Euro-Asian Society of Mastology, and the Turkish Academy of Cynology, all of which have been working together to promote better training in breast care for professionals. This book will offer invaluable support for breast surgeons by covering critical and essential information in cynology. And now for Springer Clinical Highlights in Internal Medicine.
All right, first up, in its 5th edition, Approach to Internal Medicine remains a highly successful textbook presenting an integrated symptom and issue-based approach to internal medicine. Like the last editions, this update provides a rapid review of evidence-based internal medicine in a comprehensive yet concise format, and newly includes coverage of COVID-19 treatment and cancer survivorship. The text is full of accessible, high-yield clinical information. Each topic is carefully organized into sections on different diagnoses, investigations, and treatments to facilitate patient care and examination preparation, while numerous clinical comparisons help enhance learning. Next, please. Access to approved scientific medical literature is vital in the context of providing standard evidence-based healthcare. Despite the abundance of medical information, remote areas and economically disadvantaged sub-Saharan Africa often lack internet facilities or reference libraries. At the same time, the long-term storage of books and other documents is a problem due to climatic factors, pests, and insufficient infrastructure. Clinical work and general management of a standard minimal resource facility is written against this backdrop and based on practical experience. It compiles a series of common disease management protocols adapted for minimal resource facilities. It also provides formulas for national healthcare schemes and other useful documents that can help facilitate effective hospital management in low-resource countries. This book is primarily intended for healthcare workers in Gambia and other nations with similar socioeconomical background, but it is also a valuable resource for international healthcare workers visiting economically underprivileged geographic areas. Next, please. The second edition of Primer on Nephrology provides readers with a user-friendly, practice-based approach to all aspects of clinical nephrology. It is extensively updated, offering invaluable and practical advice on how to manage specific illnesses, stressing the importance of establishing systems and processes to improve patient safety and improve clinical governance. The book is full of tips for avoiding common errors based on vast experience of the authors and aggregates vital resources helpful in the care of renal patients. This continues to be a definitive reference for practicing nephrologists and trainees, as well as for physicians who encounter patients with kidney issues in their daily practice. Next, please. The second edition of Concussions in Athletics addresses the neuromechanisms, predispositions, and latest developments in the evaluation and management of concussive injuries. This edition is fully revised, updated, and expanded with the latest research and treatment protocols, ensuring that it remains a comprehensive and timely contribution to the body of literature available on this topic. Concussion, also known as mild traumatic brain injury, continues to be a significant public health concern. The book is comprised of 5 thematic sections. These are current developments in evaluation, biomechanical mechanisms, neural substrates, biomarkers, genetics, and brain imaging, pediatric considerations, and clinical management and rehabilitation. The new edition updates aim to narrow the gap between research findings and clinical management of sports-related concussion. This book will remain interesting to a wide audience of clinicians, researchers, administrators, and policymakers, and now also offers a broader scope of knowledge well suited for professionals in the fields of neuroscience, neuropsychology, as well as other health and sports medicine professionals. Next, please. The third edition Atlas of Endoscopic Major Pulmonary Resections describes in detail the fluoroscopic approach to major pulmonary resections, in which only endoscopic instruments and monitor control are used. Pulmonary lobectomies and segmentectomies are presented step by step using basic technical notes and high quality, clearly labeled still images. Each chapter begins with background anatomical information, which is illustrated in 3-dimensional reconstructions. The new edition features all new imaging technology and techniques. Next, please. Gastric cancer, the 25-year R evolution, reflects the findings and experiences of the Italian Research Group for Gastric Cancer, which is also known as the GIRCG. 25 years ago, a monograph on gastric cancer was published by the Italian Society of Surgery, and it was recognized as a milestone in the management of tumors in Italy. Oncological and surgical knowledge in the field of gastric cancer has changed dramatically over the last 25 years. The aim of this book is to offer an essential update on current diagnostic approaches and optimal treatment strategies. The principles of tailored and multi-model treatments are examined according to the latest guidelines, providing a valuable synopsis for clinicians. Thank you.
All right. And for clinical highlights in nursing, the first title we have is Spiritual Dimensions of Advanced Practice Nursing, Stories of Hope. This is the first book to address spirituality from the APN perspective and provides a framework for nurse practitioners to help patients find hope, meaning, and purpose during times of illness and challenge. Spirituality is a fundamental aspect of holistic care, and the nurse's ability to practice with kindness, compassion, and empathy will naturally resonate with a spiritually competent practice. Endorsed by the International Council of Nurses, otherwise known as ICN, it presents spirituality as a fundamental aspect of holistic care and provides practical applications for advanced practice nurses, including case studies to illustrate how to integrate spirituality into practice. This book is relevant for all advanced practice nurses, students, educators, and researchers. The next title we have is Clinical Nurse Specialist Role and Practice, an International Perspective. This book was developed under the direction of the ICN, the International Council of Nurses, and it's part of a series exploring advanced practice globally. It is the first known volume to provide an international view of the advanced practice role of clinical nurse specialists. Advanced practice roles, including CNS, are continuing to evolve, and this book makes important contributions to a global understanding of the CNS role. The CNS role and practice as implemented in North America, Europe, Asia, and Oceania are examined in the context of the country's healthcare system, educational traditions, and regulatory requirements. For practicing CNSs, this book provides an in-depth examination of the role from the global perspective, and for administrators, it provides a foundational understanding of the CNS role and practice and performance expectations. And now for our clinical medicine highlights in oncology, orthopedics, surgical orthopedics, and sports medicine. All right, the first title we have is Common Issues in Breast Cancer Survivors. Improvements to breast cancer screening and treatment have resulted in more patients than ever before having been cured after local, definitive, and systemic therapies. Primary care providers and specialists must be increasingly familiar with the issues that breast cancer survivors routinely face. And this book provides a clinically useful resource for evaluation and management of the symptoms and issues that burden survivors of breast cancer. This is the first book to provide a single resource for common issues faced by breast cancer survivors from a multidisciplinary perspective. Each chapter of this text is co-authored by at least one oncologist and one specialist outside of the field of oncology in order to include the perspectives of relevant disciplines. This book empowers non-cancer specialists and practitioners who care for breast cancer survivors to address common issues that impact patient and patient quality of life. And now for practical microsurgery cases.
My turn. Today, microvascular free tissue transfer is an essential part of reconstructive surgery. This new book is written by an author team from China and introduces the development of microsurgery both inside and outside of China, containing the most current information on leading trends and procedures. Practical microsurgery cases introduces microsurgical techniques and applications in the pattern of illustrated case presentations. The procedures presented include digit replantation, toe-to-hand transplantation, and peripheral nerve injuries. Key technical points for replantation, reconstruction, tissue repair, and nerve repair are also featured throughout. Next, please. Fractures in Sport is a sport-centered guide to fracture management for athletes. It features extensive evidence-based guidance on how fracture management can be adapted in athletic patients to facilitate an accelerated return to sport. Descriptions of a variety of both acute and stress fracture types are included, covering both the appendicular and axial skeleton in locations such as the shoulder, knee, ankle, and spine. This book comprehensively covers the available strategies for managing fractures in professional and amateur athletes and is ideal for use by practicing and trainee orthopedic surgeons, sports physicians, and general practitioners. Next, please. This revised and expanded second edition of Stress Fractures in Athletes covers the presentation, diagnosis, and management of stress fractures in athletes using a holistic approach suitable for on the field and in the training room management of stress fractures for team physicians. Updated chapters detail treatment of the most common and troublesome sites for stress fractures, as well as recent research identifying risk factors that lead to stress fractures. As in the original edition, general principles for evaluation, healing considerations, and management strategies are clearly presented. However, unlike the previous text, this edition focuses on a holistic approach to the treatment of these increasingly common injuries. New chapters include coverage of nutritional optimization and supplementation, hormone stimulation, and injectable biologic treatment modalities that enhance healing. Next, please.
And for highlights in pediatrics and pediatric surgery.
Pediatric neurosurgery for clinicians covers a broad range of areas relevant to pediatric neurosurgery and focuses on answering specific clinical questions. The book is written for clinicians in a variety of disciplines, including oncology and pathology. It presents a detailed overview of a spectrum of pediatric neurosurgical conditions and detailed insight into the techniques available for examining abnormalities, hemorrhages, and a variety of tumors. Relevant surgical methodologies are described in relation to clinical problem or disorders, ensuring that the reader can systematically develop their knowledge of how to perform both routine and more obscure procedures utilized to treat these conditions. Next, please. Pediatric ENT infections presents the most up-to-date information and treatment modalities for both ENT and pediatric infectious diseases, including the COVID-19 infection. It brings together the experience of authors from more than 30 countries and aims to provide a broader understanding of the prevention and treatment of infectious diseases in children, ultimately seeking to improve children's health and well-being globally. The list of topics ranges from basic to very advanced, making this an invaluable resource for ENT and pediatrics trainees and students, as well as for experienced practitioners in these fields. Next, please. Written by a U.S. author team, A Pediatrician's Path, What to Expect After a Pediatrics Residency provides a comprehensive review of what comes next, drawn from the experience of those who have lived through the process firsthand. The book reviews potential fellowship areas and how to navigate the application process, guiding aspiring pediatricians as they both find and negotiate their first position. The book is comprised of 6 parts. Part 1 explains pediatric fellowships, and Part 2, choosing a career path. Part 3 and 4 aim to prepare the reader for what happens after finding and starting a job in pediatrics, and Part 5 discusses longer-term planning. Part 6 focuses on personal health and well-being, supporting stress management and balance for a healthy career. That's it.
And for our last title in pediatrics is Beyond Parenting Advice. This one provides pregnant women and new parents with evidence-based information on pregnancy and parenting, focusing on key controversial areas that have a lot of information, but also a lot of conflicting advice. The author, Dr. Michael S. Kramer, does not tell women or new parents what they should or should not do. And Beyond Parenting Advice does not cover every conceivable topic relevant to pregnancy, infancy, and childhood. Instead, it focuses on key controversial areas such as toilet training, lactation, nutrition during pregnancy, stillbirth, and a current topic with many questions, whether vaccinations are safe during pregnancy. With the information provided in this book, different parents will make different decisions, but those decisions will be informed decisions, and their decisions not because of blind obedience to a book, blog, health provider, friend, family, or public health authority. Dr. Michael S. Kramer has served as a member of expert committees of the World Health Organization, the U.S. Institute of Medicine, and the Council of Canadian Academies. He was also recently cited as among the most impactful 0.01% of world's researchers across all scientific fields. He is currently Professor Emeritus at McGill University in Montreal. And we all know about what to expect when you're expecting, but this is a book by experts instead of experts that are solely focused on pregnancy, and what to expect when you're expecting is not based on evidence-based research. Another title, Expecting Better, is restricted to pregnancy only and does not claim to review the published evidence, and omits important topics such as stillbirth, pre-pregnancy weight, and diet during pregnancy. And the last comp title to distinguish Beyond Parenting Advice is Crib Sheet. This book is directed only at mothers. Fathers have been entirely omitted. It also omits important topics such as nutrition, child obesity, and mental/emotional stimulation. This is a much less data-driven book than Beyond Parenting Advice and is not based on published evidence. The next title we have is Pediatric Thoracic Surgery. This discusses all thoracic diseases of surgical interest, from thorax malformations to airway disorders. It also reviews possible future developments in this field. It is divided into 6 main sections. The first 2 analyze general aspects, while the following 3 focuses on malformations of the thorax, airways, esophagus, and diaphragm. The final section describes the main pediatric tumors involving the chest and internal thoracic organs. And each chapter starts with a classification of the main pathologies related to the anatomical region considered. For each pathology, the various aspects of the diagnostic therapeutic procedures are described in detail, from the clinical presentation and diagnosis to the preoperative preparation, the surgical aspects, and the postoperative course. The volume will be a useful tool for specialists in pediatric and thoracic surgery, but will also represent an educational resource for medical and nursing students too. And now for our key highlights in plastic surgery. The first title is Atlas of Lip, Nose, Plastic, and Cosmetic Surgery. So this atlas covers various types of lip and nose deformities and introduces individualized surgical plans for patients. The surgical techniques are classified according to the various types of deformities. Schematic diagrams, preoperative, and postoperative photographs are supplemented by detailed explanations. The management of lip and nose deformities and defects crosses many surgical disciplines, and therefore this book is recommended to be read by surgeons of all different backgrounds, including oral maxillofacial surgery, plastic surgery, cosmetic surgery, and much more. It can also be used as a reference for anatomy and developmental biology, physiology, linguistics, aesthetics, and other basic medical sciences. Our next title is Robotics in Plastic and Reconstructive Surgery. This describes the current state of robotics in plastic and reconstructive surgery. It examines existing clinical applications, emerging and future applications, and the evolving technological platforms. Concise and comprehensive, this book is organized into 4 sections. First is an introduction to robotic microsurgical training and robotic skills assessments. Second is robotic clinical applications, including robotic breast reconstructions, robotic mastectomies, robotic cleft palate surgery, and robotic microsurgery in a urologic private practice. The next is the opportunities and challenges an interested surgeon might face when considering incorporating this into their practice. And the last is new microsurgical robotic platforms and the potential direction this technology may take in the future. This book is supplemented by high-quality videos and images, and Robotics in Plastic and Reconstructive Surgery is a valuable resource for both plastic surgeons and multi-specialty microsurgeons. The next title and the last of our presentation is Tips and Tricks in Plastic Surgery. This covers the most innovative, contemporary, and common plastic surgery procedures and aims to improve both reconstructive and aesthetic surgical results while decreasing the incidence of complications. In doing so, patient satisfaction, quality of care, and safety are enhanced. The book consists of 5 parts, running the gamut from aesthetic surgery, reconstructive procedures, pediatric and craniomaxillofacial surgery, adjunctive procedures, and finally hand and upper extremity. Written by experts in the field, each chapter describes tips and tricks through clear technical details, medical illustrations, and in some chapters, detailed videos. Tips and Tricks in Plastic Surgery will serve as a valuable resource for clinicians, professionals, and practitioners, as well as medical students on rotations. And that is our Q3 2021 medical titles presentation. Please feel free to reach out to us if you have any questions or would like to see any materials on our clinical medicine highlights. Thank you so much.
Thank you.